Hey Mitzi, welcome to the show.
Thank you so much, Brittany. It's great to be here.
It is awesome to have you. I remember I was on your show maybe a year
Right.
and a half ago, so time for
Yeah.
you to be on mine.
I'm very honored.
Well, let's let the audience know who you are. So tell us a little bit about your background and the work that you've done in women's health.
Sure. So I am an internist by training, and I was at UCLA when Iris Cantor came and said she wanted to build a women's health center, and there were a group of us that had wanted to do that. So I was asked to be the founding medical director of the Iris Cantor UCLA Women's Health Center, and it became a center of excellence in women's health. And then I went on to Humana as vice president of women's health there. And then fast forward a few years or so, and we'll talk a little bit more about this. I got into angel investing primarily because of my interest in women's health innovation. And so I'm a member of Golden Seeds and also co-lead of the health sector group that looks at everything from life sciences all the way to wellness, medical devices, therapeutics, and so forth, and have really focused in the innovation area most recently, really focusing on those barriers, helping mentor um, entrepreneurs. And I'm also on the board of the Black Women's Health Imperative, which is the largest national organization focused on Black women's health, and as you are, the Women's Health Innovation Council at Springboard, among other things. So
Yeah.
so just really immersing myself in the women's health area because there's nothing more important, as you and
Mhm.
I both agree.
Yes, we do. And remind our listeners, what is an internist for those who may not be
Oh,
as familiar with the medical field?
great question. So an internist is short for internal medicine, and we focus on the adult person and are also considered primary care physicians. I will also say that all of the subspecialties that you see, like nephrology, cardiology, and so forth, start with an internal medicine residency and then go on for more training in those specific areas.
I love that because you're so focused on women's health and yet you're a full body doctor, right? And I mean, that's what women's health is. It's the full body. It's sex and gender in every organ and system, right?
That is so true. And, that's kind of the message that we're trying to get out. I know that you and I are. Reproductive health is very important as well, but we'll go through the what's been the definition of women's health, kind of what I call the mantra, which fun fact is actually a an abbreviated version of a definition by Dr. Karen Carlson in the Primary Care of Women textbook. So, little fun fact there. But basically, it's, when we look at women's health, it is be put in three buckets. Those issues or conditions that manifest differently, cardiovascular disease being a great example, both the number one killer in men and women, but yet we as women come perhaps with different symptoms, maybe even different physiology. Once we get more research done in that area, we may know a little bit more. And then the second bucket is those that are predominantly in women. So you've got Alzheimer's, osteoporosis, some autoimmune diseases, and then that third bucket of reproductive and gynecologic health. Excuse me. So as an internist, and any physician should be asking the question, what's different between males and females when it comes to either the physiology, the symptomatology, or even the diagnosis and treatment. And so that is the mindset that I and my colleagues come to it with.
Mm-hmm. Mm-hmm. Well, absolutely fascinating. I can't wait to dive more into how you converted into an investor. I think more physicians need to be investors. But let's start our conversation today with a case study, and it's a personal case study. So, my book starts off with a story about my grandmother not being believed about her due date. And she ended up being 10 months pregnant before she demanded the baby be removed. And they took out my unborn uncle, and he was dead, he was dead because amniotic fluid has an expiration date, and you can't go beyond a certain point of pregnancy without all those nutritions being used up. And so I had the stillborn uncle, and then when my mom was pregnant with me, she also didn't go into labor, and she could hear her mother telling her, advocate for yourself, advocate for your baby, and the baby was me. And I was 2.5 weeks late, and I was born with club feet because I became too large for my mother's womb. And it was a similar story where they said, "Oh, mom, to Kelly, my mother, like, oh, you just calculated it wrong. You just calculated it wrong. You're not dilated at all." Like, and turns out, like, women in my family, we actually have my other aunt. She never went into labor either. And so when we were telling the doctors, like, "Hey, women in our family don't go into labor," they were like, "That's not a thing." And they're like, "Okay, well, that's our experience. Like, please take this baby out." And so I had little casts on my legs to bend them back outwards, and I had braces on my legs for years. God bless my mother picking up a 2-year-old with metal boots on. I mean, can you imagine how often you'd get to get kicked by a 2-year-old with metal shoes? But so this is a story of women not being believed, women knowing more about their body than maybe the medical system does. Based on your career working in women's health, do you see us improving in terms of believing women, and how much further do we need to go?
I'll answer the last one first, and that is a long, long way.
Mm,
But, there's a lot of things happening that give me hope and so, you know, just kind of walking back and and that's such a dramatic story. And unfortunately, there are different variations, I think, for most women, right? But that one certainly, brings home the problem. When we look at research on women, and again, I'm sure you've talked about this on your podcast before, women weren't included in clinical trials because they wanted to protect unborn babies. We have hormones, that's more variables, more expense to the research. And so 70-kilogram white males were much easier to study. And they're people. So the idea was that we could extrapolate. Well, we know that that's not true. In 1993, the NIH Revitalization Act was enacted, and it was because of Bernadine Healy, a female NIH director who understood, and a cardiologist, that there are differences. And so women and other underrepresented groups had to be included in NIH funded research. Unfortunately, not until 2016 was there a focus on just looking at sex as a biological variable. What's the difference in how um, females and males respond to inflammation and so forth, or even have inflammation? So that's number one. So as you know, when the research isn't done, or when research is done, it goes into journals and textbooks, and that gets communicated to medical students and physicians and other healthcare providers. Well, there's a gap, right? Because we don't have that much information on even women's biology. I mean, when I was in medical school, women's physiology was just a very small piece um, of the textbook. And so you've got this gap, but you've got physicians who don't know what they don't know. And
mm,
so when someone comes and says, I've got X, Y, and Z, and it doesn't fit into that black box that they
yeah.
have, then they assume it doesn't exist, or, and that kind of thing. And again, I think there is some bias, and I think that there is a real gap in research and education. So going back to your issue about what can happen and what do we need to do. Obviously, we need to do more research, not only on solutions and diseases, but on biology. We need to educate our physicians and providers with what we already know and that aren't isn't really getting to them. Menopause being a great example of how many women are undiagnosed, misdiagnosed. Cardiovascular disease, the same thing. And then women need to advocate for themselves so that when they have an issue, you're going to have to do some of the work yourself, get credible information, either from podcasts like yours or mine, and internet and so forth. But again, credible. And then Mayo Clinic, again, and then take that information, even wherever you get it, and have a conversation with your physician. Have that physician explain to you why you may or may not fit into that, what's described. Because again, we look at the internet and, the first thing we think of are the worst things, right? Because we check off all those symptoms and not, and again, that's why physicians go to medical school to be able to kind of distill some of that. So long answer, but I think it's really takes everybody all hands on deck at this point in time.
Yeah. Isn't it ironic? It's that we excluded women from clinical trials to protect babies, and yet the exclusion actually hurt babies, right?
Yeah.
In this kind of backwards thing. And also, like, these physicians weren't being malicious, right? They were just doing what they were trained to do. And so I'm excited for a healthcare system that has more leeway for patients that understand their body and are able to advocate for themselves and trusting the process of the patient to do what they want to do with their body, right?
Sure.
Really fascinating stuff.
Well, if I was going to, it's interesting because again, you brought up the example, and not every woman is the same, and not
Mhm.
every woman has the same symptoms or maybe the same physiology or the same genetics. So I guess what I'm very excited about is the opportunities to do more personalization. And again, I
Yeah.
know as you've had many people on your podcast that are entrepreneurs who are looking at, just checking hormones every day for a very specific reason and actually quantifying that. Or the vaginal microbiome can tell us so much, and we didn't have that information. So I'm very excited about that. The other piece that I think is a change is that we have more women. We have more women in clinical practice. We have more women in science. We have more women in policy. We have more women, certainly entrepreneurs. And we need to get, and in venture, I should say, we need to get more of them in leadership positions. But at the same time, that trajectory, I do think, has really pushed the needle in a lot of ways.
Yeah. You said personalization, and it was actually the first time I thought about this. Like, what if my grandmother and my mother were actually missing some kind of spike in a hormone that needs to spike in order to enter labor, right? And if we had technology and personalization, we could maybe have run a panel and been like, "Oh, you're actually missing the spike." And, I'm not an MD in terms of knowing what
You're
hormones
a
change during
geneticist, so
labor. But
I
yeah,
think that
maybe there's
counts for
that,
something.
yeah, a gene that gets activated during labor that softens the cervix or something, and like if we had that enough studies on women in labor that we'd be like, oh, like the Barreto family lands in this bucket, which is that they
Sure.
need this extra boost of this chemical or something to induce labor versus, well, we're just going to wait until the baby's literally too big or about to expire and then we'll do a C-section, right? So I'm speaking of personalization, let's talk about femtech. When
Oh,
was the
yeah.
first time you've been in women's health for a while, but prior to the word femtech being coined in 2016? So when was the first time that you heard about femtech, and does the industry have the key resources that you think it needs to grow today?
Well, you know that answer too. We can always use more, certainly. You know, um, I think back about when I was practicing and we were talking about the fact that we were having the same conversation with our patients about menopause, for example. And we thought about, again, this is before some of the technology was available, um, to think about, could we get everybody together in a group and just have that conversation and then, go off and talk to people individually, and so I think that if we had had that technology that we have now, that, again, we're translating that kind of thing. So the technology that is, when we think about, again, what is that other piece that's needed has been the technology and certainly the adoption of telehealth in a huge way. But when I got involved, I didn't know the word femtech. It was a little bit before that, but I had women uh, to what we call curbsiding me for my medical expertise because they were building companies and solutions for problems, and those solutions they couldn't find them on the shelf or in the healthcare system. So they were again using their technological skills, their knowledge of what they needed, so that they could provide more solutions for more people. And that was a light bulb moment for me. I said, this is how we are going to progress or advance women's health. Again, thinking about again that time when I just wanted to get people in a room together to talk about menopause. So I literally wanted to invest and luckily was introduced to Loretta McCarthy, who is the co-CEO of Golden Seeds. And we invest in women-led companies. And obviously, the majority of women's health companies are women-led. And we invest in an early stage. And I co-lead the health sector group, which I think I said already, looks at everything from life sciences to wellness. Obviously, my sweet spot is women's health. And I really have immersed myself in the women's health femtech space. And it's been amazing. The pandemic allowed me to, connect with folks like yourself and so many others that we know in common, both nationally and internationally, and really involve both in, mentoring entrepreneurs, using my expertise as a physician and also knowing the healthcare system, but also becoming educated about what some of the barriers are. And
Hmm.
as you well know, whether it be regulatory issues and trying to get something through a process that is not very, doesn't have a lot of knowledge about women's health, if you will, the funding issues, and so forth. And so that's where I've been spending my time. And we do need more resources. We need more people investing. And not to get on a bully pulpit, but I will for just a moment. I see so many women that don't have a problem or don't think anything of writing a large philanthropy check because they want to make impact and they want to make the world better. And so if anybody is listening that writes those kinds of checks, consider writing a check that for a business, for an entrepreneur that is wanting to make an impact in women's health. Obviously, you need to do your due diligence and make sure that, all the I's are dotted and T's are crossed. But that not only provides an impact, it also provides potentially a financial outcome for you. And it also, for me, it expanded my world in terms of learning about investment and finance and all of that, which was not something you talked about physicians getting into it. Yeah, not something I was taught in medical school. Um, but I do think that, you know, there's a lot of opportunity, and I think there's a lot of untapped resources that we need to focus on. I worry about this next few years with respect to research in women because that seems to be, unfortunately, a dirty word in grants right now for this new administration. And I worry that many of the clinical trials and the entrepreneurs that need those clinical trials and that funding will not get them, so that we're going to need more resources and sources of funding, such as family foundations, private donations, not even donations, really investment. I mean, that's what it
Hmm.
is. That's what research is. It's an research funding is. It's an investment in women's health. And now I'll get off my soapbox.
Well, I'm going to invite you to keep standing on it because I'd love to talk more about funding and investing in women's health. Um, we find that sometimes it's easier to convert women and females into investing in femtech companies because they understand the problem so easily, right? Compared to a male investor who may have never heard about a uterine fibroid or understand the impact of a menopause hot flash, right? And so, how do you think that we get more women into investing and what do you think is like the biggest challenges? Like, why are men more easily willing to become an angel investor versus women are more philanthropists versus investors?
It's interesting. I think it's a mindset. We don't think of ourselves as putting our money um, in investments as opposed to doing good. But just to really spread the word, you can do good and do well. I also think it's interesting. I asked someone who actually has an impact fund, you know, she works with a lot of wealthy women. And I said, how can we get more women into investing in this sector? She says, it's really interesting. I thought the same thing you did about in terms of if you're writing a philanthropy check, write it, for an investment. She says, with investments, philanthropy checks, women feel comfortable writing themselves. And again, I know that this is a gross generalization, but when they go for investment, they feel like they have to ask their partner or their spouse.
Mm.
And I never really thought about that. And again, people can listen and tell me I'm wrong, and that's great. But I think it could be a barrier in just the way that we think about uh, investment. I think, it's interesting in Golden Seeds, we have what's called the Knowledge Institute. We've got Angel Investing 101. We have, again, very accessible education. The Association for oh gosh, ACA, which is the Large Angel Association, has a lot of education. And I think that anybody that's interested, it seems formidable. You think of investors, you think of lots of money, you think of, you know, what's my little check going to do? But it's
Hmm.
those early checks that make all the difference. It makes all the difference in terms of if that entrepreneur is going to even get to that next level
Yeah.
and be successful. So, I think that we just need to do some more education and more socialization of this, to be quite honest.
Yeah. Do you think the catalyst was for you to become an angel investor with a physician background? And if I may ask, do you think that your partner, your husband, being in technology and in businesses, do you think that in your household you were talking more about business and so maybe it was an easier conversion for you to become an angel investor?
Maybe subconsciously, but
Mm-hmm.
it's interesting. I really came at it as the vehicle to advance women's health.
Mm-hmm.
I just saw it as having been in the business for a long time and seeing how, we know about these differences, but we were kind of just plodding along.
Yeah.
And then here we were, these women were again being so creative, so smart. Uh, it was really exciting, actually. And that's
Mhm.
the other piece about investment. You get to see and hear about all these really cool things, right?
Yeah. Yeah.
Um, and so, both my husband and I are not your typical physicians. So I
Hmm.
think that probably that is a piece of it. We understand the impact of things like policy and finance and um, the business of healthcare. So perhaps that's piece of it. But I really do think that the engine for me, for my working for my going forward was this wanting to advance. I love the angel investment piece of it because it's at least for with Golden Seeds, we do our due diligence as a group. I mean, we're not just handing over money for someone else to figure out what are the right investments. We're really rolling up our sleeves and doing that, and we're writing and determining our own checks and our own check sizes. So
Yeah.
there's a lot. I feel that I have a little bit more, not so much control, but I have a lot more insight into what I'm doing.
Yeah. Well, speaking of the momentum, over 50% of femtech startups have been founded in the last 5 years. So you've been working in women's health for a while, and now all of a sudden here's this boom. What motivating factors do you see that are driving femtech in this wave of innovation?
Sure. I think it's all the things that we were just talking about. I think it's more women in all sorts of areas. I think that some stigmas have gone away just because people are starting to talk about things like menopause and all of that. We still have a long way to go on social media to let us, actually advertise some of the things
Yeah.
that our entrepreneurs are creating. The technology piece is definitely, the catalyst in a lot of ways. And so it's really a perfect storm. And and then I think consumers are also much more demanding and
Yeah.
the more they see you can do, the more they want. And I think that drives. I also think that, we all know the statistics. Women make the majority, 80% plus of healthcare decisions for themselves and their families. They're more on the healthcare spend. They have more disposable income and will continue to increase that as we go along in terms of controlling income. And I do think that we want more control and we want more convenience. And a lot of the technologies we're seeing um, empower women to do things on their own time, don't have to go get blood drawn, don't, that kind of thing. And then again, an increasing awareness about, oh, this pain that I have been having for 6 years, maybe that's endometriosis. and then posing that with their physicians. And then again, there's a lot of people that are again identifying their own issues, finding out they're not alone, finding out that there's a market, and then, driving forward.
I love that as a factor, patient awareness and self-advocacy, because I always talk about the rise of female founders, the rise of females in STEM, the rise of women in investment, all of these factors. But I think I actually usually leave out that part where when women, realize that they've had a sleeping mask on the whole time and they have a little peak of light and they're like, wait, what? Like, huh? You start to peak and peak and peak and peak. And that's, I mean, my own story. I remember the first time I was really thinking about women's health and femtech. I was a PhD student. I was doing internship with a startup. It was an at-home test, and they were thinking that maybe their test could be used for hormones. And as my internship, they said, "What hormones do at-home fertility tests look at? Okay, and give us a report about what hormones they look at." And I was like, "Okay, okay." And I'm looking this up, and I mean, I must have been 23, already a biology undergrad done in my PhD for genetics, female, actively on birth control, active sexually. And it was the first time that I realized that I was only fertile a few days of the month. And I remember sitting in a cafe being like, filled with kind of like shame. Like, how can I, an educated feminist woman working in life sciences, have just realized that I'm only fertile a few days a month? Like, I really thought like most of the month, except for my period, I was fertile. And it was the first time I realized I know nothing about my body. I don't think I really understand my body. That was the first time, and I wasn't even in femtech yet, right? But it was that first realization that like I might not know a bunch of things I should know about, right? And then, but that's when it started. That's when the journey
Sure.
started. And what I hear you saying is that because there's been so much momentum in the conversation around femtech, that women are now starting to see documentaries like The M Factor,
I
or
was
they're
going to say,
seeing,
yeah.
yeah, and they're listening to podcasts like Beyond the Paper Gown. By the way, that's Mitzi's amazing
Oh,
podcast.
yeah, I
Check it
forgot to
out.
ask. Thank you. I forgot that piece.
Beyond the Paper Gown, where you can learn more, right? But it's like once you start to realize that like we've actually been kind of blindfolded, and not that I'm saying that somebody's blindfolded us, it's just been this kind of unknowing darkness that we've all been in. But now that we're seeing this light, we're asking more, we're chiseling away. And I think you're absolutely right. We are in an era where we're saying we deserve better, we deserve better. And so that patient advocacy for solutions is driving it as well. I've never really thought about that.
Sure. And I go back to the investment piece. Not sure where this fits, but the other thing about men and women, and we've heard this so much, men, when we say something about women's health, oh, that's niche. It's a niche market, right? And it's like, okay. And, I was at a recent event and I said, uh, how many of you work with women? And people, how many of you work for a woman? People, raise their hand. How many of you know a woman? Everybody raised their hand, amazingly. So, we have to also remember that. And what's also, I think, powerful is that all those women that you mentioned in those different areas, policy, investment, science, clinicians, those are all women consumers as well.
Yeah.
And so, and I do think that that also is the piece that's, driving this.
Yep, 100%. Well, so as an investor, I'm a former investor. I worked at a venture fund. I co-founded Coyote Ventures. You need a lot of data to make good investment decisions. And that's why at Fem Health Insights, we're really focused on data because we want to supply the right information for founders to be able to pitch to investors and provide data to the investors to feel comfortable making investment decisions. We calculated in 2021 that femtech is worth over 1.2 trillion. So not niche at all. In
There you
fact,
go.
overflowing with opportunity. As an investor, have you found it challenging to find data and insights? Because even when we calculated the 1.2 trillion, we left out a bunch of things. Like no one had ever calculated the market value for PMS. Like how much are women spending on their PMS symptoms in terms of Advil or heating pads or time off of work? So we think 1.2 trillion is actually super undercounted. As an investor, have you found it challenging to find the data insights that you need to make good femtech investments? And if so, which data do we still need to fill in?
I think your point about we really don't know what the addressable markets truly are in certain areas is really key. So I think that it's always safe that for those investors, those entrepreneurs that have looked at this, that we assume that that's a conservative number. So I think that's really helpful. I think that what you've done with the, just inventorying what's out there is so key. You
Mhm.
know, you and I have a good feel for what's out there because we talk to entrepreneurs on a daily basis. And that's what I think I bring to, in terms of value, sometimes with some of the women's health companies that we see. But short of that, if you don't have someone like that, and I can't know everything, that's there, that I think is a piece of data that is not easily um, gotten
Mhm.
as well. And I will say, and this is to the entrepreneurs, though, when you're pitching and you say that there's competition or you go through your competition slide, make sure you're either not withholding any competition or you really do know what your competition is.
Mhm.
Because sometimes, I'll see a pitch and I'm like, but isn't there another company? And I kind of wonder. So little tidbit there. Um, the other piece of it is not knowing from a very basic science standpoint what is the true need.
Mm.
So we think we know how many people have endometriosis, we can guess,
Yeah,
but we don't know because so much of it goes undiagnosed, and all of that. So, but in general, I think that when I think about companies and how we evaluate them, there's no real magic. It's the same way that we evaluate any other company. It's just understanding um, what the issues are and making sure that those numbers, you know, um, come from good resources or references.
definitely. Yeah, I have found that when even searching for competitors, right? So you want to find every endometriosis company out there, let's say, right? Because of censorship of women's health on social media and the internet, sometimes it's actually hard to find all the other companies because they're literally blocked from using the word that they want to use. I mean, endometriosis maybe not blocked as much as, let's say, urinary incontinence or, female herpes, right? Like anything that has to do with STDs, like super censored, right? Or sexual pleasure for women,
Right.
pelvic floor exercises, the word vagina, right? Like, gosh
Or
forbid if you're
breast.
yeah, or breast, even breast is like so censored. And so sometimes it can actually be quite challenging to find out what other companies are in this space because of the online censorship of it. Your Google, your first three pages may not be actually coagulating the right companies that you're trying to Google for.
Sure. And the other challenge is that so many companies in the women's health space are new. So
Yes.
those are always harder to find than established companies or companies that have, made it farther down the pipeline.
That's right. Totally. Totally. Well, I want to talk to you about a new endeavor you're working on, which is called FemTech AZ, which is all femtech in Arizona, which is really exciting. To my knowledge, it is the first state-based femtech organization. So there are now, I think, about 28 countrywide femtech organizations. So when I started FemTech Focus, we were like the first one out there. But now there's FemTech France, FemTech Canada, FemTech Israel, FemTech Australia. Like there's 28 of them. It's so cool. But now you are co-founding the first ever state-based one. So tell us more about this organization, FemTech AZ. Why are you starting it and why Arizona?
Sure. Well, about a year ago, one of the other things I mentioned is I'm on the advisory board for this menopause app called The Pause. And the CEO, Susan Sly, decided that she was going to coordinate at a FemTech summit. And it was the first of its kind in Arizona, as far as I know. And I was part of that as well. And it was really well received. It had so many people from so many
I was
different
there. I
areas.
was there.
Oh,
It was
that's right. Yes,
amazing.
yes,
Yeah,
yes, of
I
course.
actually came to it. And I mean, a
Yes,
packed house. Women were moved. I was having lunch with women. They were like, wow, this is incredible. Sorry to interrupt you, but just,
sure.
yeah,
No.
co-signing. Yeah, it was amazing.
And it goes back to your point about, the mask being taken off
Yeah.
our eyes, right? Like people getting very excited. And so another mutual friend of ours, Azine Radson Van Allebeek, who is the general partner for Emmeline Ventures, was part of that as well. And she said, I think we should make, Arizona the FemTech hub. Well, I won't go into all the, the details, but she had a really good idea. And so between the three of us and another individual, Sydney Peck, who is a multiple entrepreneur or serial entrepreneur and just really incredible organizer, we put a stake in the ground and said, you know what? We have in Arizona an incredibly entrepreneurial ecosystem. We have just so much support for early stage entrepreneurship. ASU has always been number one in innovation, so it kind of reflects that. We have large healthcare systems that are also making innovation part of their mandate and are doing clinical trials as well as pilots there and want to do more. We have payers here. We have a government that wants to bring more business into Arizona, especially more entrepreneurs, as well as support the ones that are here. And we also already have some femtech entrepreneurs, and we have 5 medical schools, 3 of which are public schools, and all of which are doing research, and much of which could possibly be commercialized in the women's health space. So it was kind of this, no-brainer, right? That we could coalesce all of these different stakeholders to come together to support women's health and women's health entrepreneurship, not only for the economic advantages, which are certainly significant, but I think we have a real belief that when we increase awareness through these initiatives and throughout this ecosystem, that we will improve the health of women. It will be a snowball effect, and we hope to also measure that. So that's that's the short of it. And we're very early in this stage, but I haven't had anyone say that they don't want to be a part of it. So
Yeah.
I'm very excited about it.
Well, one of the things I love about FemTech AZ and this idea of, in particular, like Phoenix being a hub for FemTech is that when I think about who is operating in FemTech, a lot of times it's women and a lot of times it's women with families. And so when you think about your typical startup founder, he may be a young early college grad or college dropout white male who can move and rent a room in San Francisco, right? And chase his dream of building a tech company, right? Oftentimes, the founder of a femtech company is a mid to late 30s or 40-year-old woman who already has kids, but she's determined to solve this problem. And asking her to up her family and move into LA or New York City or Boston to pursue her startup is a huge ask. Those are not cities that necessarily are family friendly or affordable. And yet, if you think about Phoenix, it's a major city, huge international, very accessible airport. So you still have access to all the coasts and countries, but it's a place where you can bring a family and pursue your dream while not disrupting your family's, going to great schools or your husband's job, et cetera, your partner's job. Do you find that as well as a factor?
That's what we're hoping, right?
Yeah.
I mean, it makes sense. And that's why a lot of people are already here.
Mm-hmm.
And, and your point is so well taken. One of the reasons why we founded an Arizona chapter of Golden Seeds was that we knew that there was entrepreneurship going on here that may not be exposed to investment on either coast, where again, many of those startups are and much of the investment is. So this is a way also for these entrepreneurs, not only through Golden Seeds, but through some of the other venture folks, as well as hoping to get more to expand the exposure of these incredible Arizona companies
Yeah.
on a national basis.
Yeah. Well, Mitzi, it is such a pleasure to talk to you. I always love to hear about your journey and your insights because you come from a really impactful background, having worked in women's health before it was a thing, before it was before it was hot.
Right,
And
exactly.
and
Full was
also
cool.
yeah, and also just being a systems medical physician and seeing the systems of being female or male and how that goes into medicine, innovation and investment. Thank you so much for all you do for women's health. Seriously, thank you. And thank you for being on the show today.
Well, you as well. It's always a pleasure. Thank you.